The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. Many times, prior to sitting up on the edge of the bed, you will want to have a patient roll on their side. Or you might want them to roll as part of changing position in bed. This video is going to demonstrate some issues to consider when assisting a patient with rolling. First, you will see how the bed rail can get in your way if left up. It can cause you to have poor back position if you need to assist the patient in rolling. Instead, lower the bed rail down so that you can be closer to the patient as you assist. In some cases, you might consider leaving the bed rail up, as some patients will be able to effectively utilize the bed rail to assist them with rolling or pushing up into sitting. However, remember that if you need to physically assist the patient a great deal, leaving the bed rail up will make it difficult to get close enough to your patient to assist, yet maintain a good back position. Additionally, some patients may not have bed rails at discharge, so having them practice with the bed rails down will make the task more similar to what they will need to do after leaving the hospital. Next, ensure that there is adequate room for the patient to roll on her side, but not be so close to the edge of the bed that she is in danger of falling off. You can see here that the patient was dangerously close to the edge after rolling. To create adequate room to roll, it may be necessary to assist the patient in scooting sideways towards the far side of the bed prior to rolling. If scooting sideways is required, first lower the bed rail down so that you can more easily reach the patient to assist with the scoot. You'll also notice that I have the bed raised up so that I don't have to bend down very far, and am flexing forward at my hips rather than through my back. Have the patient bend both legs, placing her feet flat on the bed. Then instruct her to lift her hips and slide her lower body sideways. The patient can also use her elbows to raise her upper body so that it can move sideways as well. You may need to assist with your hands under her pelvis and/or shoulder girdle. If the patient requires more assistance, you may need to use your body weight more to assist with the movement, shifting from your front to your back leg as you assist her in moving towards you. Additionally, if the patient is large or is unable to assist very much, this movement could also be done with two people on either side of the bed using a draw sheet under the patient. Now you can see that there is adequate room for the patient to roll.